push for this. Yay, we're recording. I'm here with the lovely Lisa Jewell. She is a beautiful chiropractor in Portland, Oregon. I'm Kristine Pedersen. I always fail to introduce myself in situations like this. But we're going to talk today about ways to support parents and moms particularly during the childbearing years. Lisa, will you introduce yourself a little bit and tell us about why you are...
Uh-oh, I lost you. Say that again.
There we go. Perfect. Perfect way to start. Just introduce yourself a little bit.
Yeah.
Tell us why you ended up here doing what you're...
Yeah. Can you hear me?
This is awesome.
There we go. Yes. Well, thank you for that introduction. I am a chiropractic physician who specializes in women's health. And I really got into this work when I was working in a downtown clinic, and I was just seeing a lot of working moms, and they were coming in on their lunch break, the only time they could go do appointments. And they're like, oh, I have all these things going on, but you're the only person I can come see because you're right at my work. And so then it really snowballed into like, okay, how can I do more and more for these moms where they can just come to one place and get the essentials that they need to recover? And I think the biggest thing I have learned on this journey is that moms postpartum are the most underserved group in our medical system, in our country, in our culture. And they don't know about all these services that are available to help them recover and regain the strength and the functionality that they had before baby. So I do, a lot of prenatal work, obviously general aches and pains of pregnancy, a lot of birth prep, and then I specialize in core and pelvic floor rehab, prenatal and postpartum. And I think the biggest thing I want to say is like starting while you're pregnant or even before you get pregnant sets you up for such a better postpartum recovery. So even if you're like, I have no symptoms, I feel great, it doesn't mean that you're going to feel great later, right? So having that foundational work and knowing how to use your core and pelvic floor, because they're going to do a lot of work. That's, I think, the biggest thing you can do for your postpartum self.
I love how you said that, right? It's not like our body is failing. It's just doing a lot of work, and it needs support through that journey. Okay, you mentioned the essentials. Will you just list off what are some of the essentials that we're missing from the typical, maternal health care that you supplement?
Yeah, I mean, I always like to compare us to like European countries. We're in Europe, women are getting up to a year of paid maternity leave, so they have time to recover and rest. I think rest is the biggest thing that we don't get here. We've kind of lost that tribal mentality, and if a new mom can stay in bed for 2 weeks and stay in her house for 4 weeks after her birth, her recovery is going to be a lot better. I mean, that's just what we're meant to do after childbirth. So, having a support system, I think, is a big one. So I really like to make sure with pregnancy, you've done, your meal train, you have maybe like family or a postpartum doula lined up, you have a lactation consultant or a sleep coach that you have you picked out. So when you need them, you don't have to be searching at midnight while your baby's screaming, right? And just like getting you set up as best you can. And then postpartum, in Europe, women are getting 12 visits, just every woman postpartum, 12 visits of rehab for pelvic floor and core. The little research we have now, which is not much, but we're starting to get some, shows that doing that rehab postpartum, regardless of if you're symptomatic or not, reduces your risk of prolapse and incontinence postmenopausal by 70%, which is a huge amount. So I always say, think of your older self too, that you're doing this work for, right? So, and then obviously there's just all the normal like aches and pains. You're nursing, you're holding this baby, you're up and all hours of the night. So it's like a lot of tension up here. You maybe feel really weak and disconnected. Maybe you do have some pelvic floor symptoms. So it's, you know, there's one place to come and get that physical therapeutic work done to help you get through that season of life.
Yeah, I think about what a game changer it was to do like lots of yoga, but also just to have regular adjustments and acupuncture and massage through a chiropractic center that I went to. Okay, I love you're leading us right into, you mentioned prolapse and incontinence. So will you just take apart these two things and give us some hope, Mama? Give us some hope about how we can effectively help our bodies heal and be stronger.
Yeah, I have a really functional approach. I mean, when you have a new baby, you don't have hours to be doing PT every day. That's not realistic. So I like to really teach women how to use their bodies more functionally just in their life versus giving them 30 minutes of exercise to do, because that's really how we use our bodies anyways. That's actually going to do more for you than 30 minutes of exercises a day. If every time you think of it during the day, you do some of these really simple, basic, foundational strengthening things. So I think the first thing I definitely want to say is, you know, incontinence is leakage, either urine or fecal matter, right? There can just be a little lack of control. And, you know, the immediate postpartum period, that's normal. Like that's okay if that's happening. That's totally common. And that usually will heal between that 6 and 12-week mark on its own, if there's nothing more nefarious going on. Same with that kind of heaviness feeling, especially if you've had a labor where you've pushed for a really long time, or baby was riding really low the last trimester, right? Like you probably will have that sensation of like, oh, something is falling out. That's not normal. But that can just be that can be normal, and it can heal again in that 6 to 12-week period. Now, that being said, I don't think it's a bad idea if you have those symptoms to be like, no, I'm gonna just get ahead of this. I just want to be proactive. You know, I've seen women 2 days after birth, and I think my average is they come in at that kind of 6-week mark when they're feeling like, okay, I can actually think again and I can start doing some stuff. They've been cleared by their OB just so that everybody feels really safe and on the same page. And then, you know, at that point, if they're having some of these pelvic floor issues, we can do a really thorough internal assessment, which I think is really important to know for sure what's going on. I mean, we can talk about it and we can delve a lot from symptoms, but really getting, you know, hands on the tissues and feeling if there is movement of organs, feeling the pelvic floor musculature, feeling your strength. Those are all really crucial to a true diagnosis of what's going on.
Okay, so I'm going to pause you there and say, if you clarify that if you go to your doctor and your doctor checks off a bunch of symptoms and gives you a diagnosis without an internal assessment of tissues and organs, your recommendation would be to ask them to perform that or see another care provider?
Yeah, definitely. I mean, a lot of OBs now and even midwives aren't trained in assessing the pelvic floor. So, you know, sometimes it's not that they don't want to do it, it's that they just, you know, they have 15 minutes, they haven't really been trained. So usually they will do, you know, they'll like assess your stitches and they'll, you know, at least go in there, but you're not getting a full like physical assessment of the pelvic floor, the pelvic bowl. So, and I think most OBs out here at least are really honest about that. They're like, yeah, I'm not sure. I think you should go see someone who specializes in this who can give you that thorough exam. And then I think we had a question from somebody, right? About.
Yeah, it was, yeah, we did. We had a question on the Facebook page that was about a tilted uterus. But I see in yoga a lot of like prolapse, people who are coming to yoga to get stronger for prolapse. And so I think both of those things are common, really common struggles that I don't feel like people are fully supported or educated around what's possible for them.
Yeah, right. So yeah, I think making sure you got that thorough assessment. I think that person in particular had gone to an orthopedic surgeon, and so my saying is always, if you go to the bakery, you're going to get bread, right? You go to a surgeon, they're going to recommend surgery. So that might be the best recommendation, but it also might just be the only thing they do, and so that's what they're saying to you. So I would definitely encourage someone to, I think in any medical situation now, we have to be advocates for ourselves. We can't rely on our providers just knowing what's best. Like, our medical providers are overworked, undersupported themselves. And so that's a whole nother issue. But we really have to be proactive about getting multiple opinions and feeling really confident in what we're being told and how we're going to progress forward. So that's my first spiel. And then I think, even if it is that, worst case scenario in our minds, doing rehab is only going to make things easier and make your recovery better, right? So I always give the example of like bunion surgery. Bunion surgery is probably the highest rate of relapse, like you have it again and again. And that's because we do the surgery, we repair the issue, but then we don't change the functionality of what caused it in the first place. So it just comes right back. So, I have a lot of moms who've had like hernia repairs. They've done pelvic floor PT, they've done multiple rounds of it, but it returns. And it's like, okay, well, then we're not addressing the root cause of this issue, because otherwise it wouldn't be coming back. So another thing I see a lot with pelvic floor therapists is that they really just only talk about the pelvic floor. And the pelvic floor is not its own entity. It's the core, our diaphragm that we breathe with, and our pelvic floor are a unit, and they are meant to work together. So if we're not addressing all three of those things, then we might not be addressing all of the issues and correcting everything that needs to be corrected. So that's another big thing I tell people to look for is, okay, were you just doing pelvic floor Kegels nonstop? Was that it? Or were they talking about breath and core stabilization? And were they giving you full body exercises? So those are some other tips. I'm always like, this is where you have to be that advocate again, right? You have to be like, oh, this doesn't feel like the complete picture. So I need to keep searching to find those other things. And it's a shame that we have to search and go to different places for that, but that is just our reality in this country. But I think having the knowledge that it's out there and there's more to it than just the one reference that you get.
Well, I remember that stuff so clearly, right? Like looking online all the time for like the one thing that would give me the answer to pelvic floor health and healing. And you buy into all these little things, and I wish that I had just had a healthcare provider that could have coached me through a relationship with my body, not just solve the one issue. So it's really beautiful that this is what you do for moms.
Yeah, I mean, and I can't do everything either. So I have a huge referral, network that I work really closely with. Like, we have this beautiful list. We talk to all these other providers, mental health therapists, acupuncture, other PTs, because sometimes you do need multiple people, but it's knowing that community and like, okay, these are the people you need to see for what you have going on, and just having someone support you in that journey of like, hey, we're going to work through this together, instead of you just Googling at home, floundering, right?
Guilty.
I mean, we all are. We definitely all are. But that's that's what I'm really trying to create in this town, is that sense of community and support. And it's a great place for it. We have a lot of amazing birth workers here.
Right. And I think that the cool thing too about what you provide is the sense of like hope that helps with motivation, because I kept like buying all these one-off like toolkits, and they'd show up at my house and there'd be like, an exercise band and like a list of Kegels to be doing. And I would it would all just go in a bottom drawer somewhere, because these I wasn't motivated to utilize the tools. But when you have a community, when like literally the support you get is tapping the part of your brain that helps produce all these good feeling hormones, right? That like leads to healing. So we come to Lisa, we get all these warm fuzzies, and we feel a greater sense of motivation to keep doing hard work, right? To take care of ourselves. I think that has been my biggest challenge as a parent, is knowing how, like, it's challenging to parent these other little people, but it's actually really challenging to parent myself. Like, to keep remembering how much care and rest, which you touched on earlier, I need in order to be healthy and well myself. And that is just so important. My own journey with pelvic floor support is, I'm 5 years postpartum, and I feel like I still don't have all the little tiny pieces put together. So, you know, the idea of having something functional that goes along with it is awesome.
And that's so common. I think too, we live in this fast-paced culture where we're used to like immediate results, right? Like we're like, oh, we have to go back to work right away. Oh my gosh, I have to do everything. I have to be a super mom and do it all myself. And like, that's not reality. You know, some of these things do take years, and then we have another baby, and then it's years again. And it's having someone saying, that's okay, that's normal. You're on this journey and your body's doing exactly what it's supposed to be doing. But in our life, we have so much control and everything's so instantaneous that feels really hard.
It's like you're failing somehow if you need to really invest every day in your own well-being. But that's actually a huge gift. So when we have healthcare providers, mental health care providers, and physical health care providers that can help us remember that in a sweet way, it's really valuable. I want you to tell me 2 more things. One, what all the services that you provide there, at like your in-house clinic, and where it is, like where we can find you. And then will you also tell us who your ideal clients are? Like, who are the mamas that you love to see walking through your door?
Yeah, absolutely. Well, right now I am in downtown Portland, and we have 2 doctors here. We specialize in, like I said, the prenatal Webster technique, spinning babies, the core pelvic floor rehab. We do craniosacral. We do a lot of latch support. So we work with a lot of lactation consultants with newborns. This is something too where these moms are coming in, they're having a lot of latch issues. Okay, what can I learn to help these moms help their babies have a good latch? So doing more of the musculoskeletal work for latch in conjunction with the IBCLC work. So important for so many babies. And that we are going to be moving to North Portland, hopefully in a few months here. And so we will be expanding, adding in some massage and some other therapies, potentially even an in-house lactation consultant, which would be amazing to do in tandem. So some big exciting things coming down the road. And I think our ideal client is like I said, that mom who's, you know, preconception or in her pregnancy and is wanting to lay some foundational work, maybe needs, you know, having some back pain and wanting to make sure baby gets in that optimal position, and then working with her in that first year postpartum to help her recover and regain all that functional strength as best as we can.
Oh, and there's so much need for that.
I know, yes, so much need. And my biggest message is always, I just want moms to know that's out there. That is a thing that they can go get, and, you know, recognizing that is coming from a place of privilege, that not everybody does have access to that, but for those of us that can, it's pretty crucial to our long-term health.
Well, and I think when we talk about the privilege of taking care of ourselves well, the more we give ourselves permission to do that, the more we give others permission to do that, and the more available these services become to help those who couldn't access it before. Right. So the greater awareness we have, and the more I think we give ourselves permission as a individual and as a culture, we begin to integrate these healing practices, these healing communities, into areas where they may not have been available before. There's no other way to do it. It's like doula services 40 years ago. They didn't exist. And now it's quite common, especially in Portland, to have doula services available at a hospital. So I have hope that as we continue to send these messages of what's possible for moms, either pregnant or postpartum moms, they'll start walking in your door and like taking it in, empowering themselves with that.
Yes, and telling others and sharing that. Yeah. Absolutely. Totally agree.
Yeah. Good. Well, I always love chatting with you, and I am so glad that we found each other because our mission is the same, right? To access more and more mamas who are struggling with exhaustion or physical pain or emotional needs that they're struggling to get met, and finding these sweet communities to support them in all sorts of ways. And that integration, I think, is also really important and unique.
Yeah, absolutely. Well, thank you so much for having me, and I'm excited for people to know that we're here and to know that the services are here.
Look at this. Well, yay. Okay, you have a busy day. Go love on some mamas, and thank you so much for being here. We will see you very soon, I'm sure.
Wonderful. Thanks, Kristine. Bye.
Bye, Lisa.